Okay, thank you everyone for joining us. My name is Jenny Jasinski and I am the program coordinator here at Pink Lemonade Project. And I apologize for the gray screen. I'm having a little technology issue at the moment, but I'm over here on the small screen. So I wanted to introduce our speaker, Kate Lenahan, and she is a cardio-oncology nurse navigator with Providence Healthcare System. She specializes in managing cardiovascular health during cancer treatment. She earned her associate's degree from Portland Community College in nursing and a Bachelor of Science in Nursing from OHSU, Oregon Health and Science University. She is an oncology certified nurse, showcasing her specialized knowledge in oncology nursing. Kate began her nursing career at Providence Portland Medical Center in the inpatient surgical oncology unit, where she worked for many years, and in 2002 transitioned to the role of Cardio-Oncology Nurse Navigator at Providence, coordinating care among cardiologists, oncologists, and other healthcare team members to develop individualized treatment plans for her patients. She also provides support, helping patients and their families understand and manage their treatment plans. She's an active member of the International Cardio-Oncology Society and meets monthly with other cardio-oncology nurses around the country to improve cardiovascular care for those patients. And outside of work, she enjoys gardening and camping with her husband and dog and spoiling her cat, which she just shared with us a few moments ago. Okay, so I'm going to go ahead and ask everybody to mute themselves, and then I'm going to turn the presentation over to Kate. And then at the end of the presentation, we'll take questions in the chat after I turn off the video. All right, thank you. Welcome, Kate.
Thank you. Okay, let me share my screen. All right. So I think you guys can all see that. So thanks for having me. This is a really fun opportunity to talk about kind of what I do on a day-to-day basis and share it with people outside of my patient population or outside of my specific patients at Providence. Very much wanted to thank Jenny and Twin and Marietta for putting this together. So I appreciate all of the work that went into that. So as Jenny mentioned, I am a cardio-oncology nurse navigator at Providence. And so basically what that means is we in our cardio-oncology program work with patients who have cancer and some sort of cardiovascular disease. So that could be patients who have a new diagnosis of cancer, but had pre-existing cardiovascular disease that was not managed, and it needs to be managed before they can start getting their cancer treatment. It could mean patients who have had prior cancer treatment, but now have new cardiovascular disease that could be related to their prior cancer treatment. Most of the time, the patients that we see, though, are patients who are undergoing treatment for cancer and have some sort of cardiotoxicity or cardiac side effect that has come up either as a result of their cancer treatment or kind of aside from their cancer treatment, but while they're undergoing treatment for cancer. And so we basically manage all of those cardiovascular issues that come up with the goal of allowing patients to stay on their cancer treatment. And that is always our goal, to manage cardiovascular stuff so that we're not impacting or holding or discontinuing cancer treatment. This is just kind of an overview of what I'm going to talk about. I know that I'm talking to a group of people who are very familiar with breast cancer. And so I included, this presentation's a little bit long, and so I included information about breast cancer, but I'm going to kind of breeze through that so we can focus on the cardiovascular health aspect of it. So I'll skip over that, and we can always come back to it later if people want to in the questions. But just kind of an overview of why we are talking about this in the first place. Cardiovascular disease, also called heart disease. It's also abbreviated as CVD, but I'll call it cardiovascular disease and heart disease in this presentation, is the leading cause of death in women. Cancer is the second leading cause of death. We have found that early detection of cancer and screening for breast cancer, plus the huge improvements that have been made in treatment options, have led to much better
Kate,
cancer
it
outcomes.
hello, Kate, it's
Yes,
Marietta. We can't see the slides.
you can't
I
see
don't
the slide.
know. Am
Uh-oh.
I the only one? I don't think I'm
Think
the
I'm
only
the
one.
only Yeah, no,
A lot of people can't see any slides.
Okay.
Okay.
we were just gonna jump in there.
Thank you for letting me alone. Let's see if we can do this. Try this again. Was that no? No slides?
So far, no slides.
Okay, hold on.
Are you sharing your screen? All right.
There we go.
Okay.
Yay.
All right. Thank you. Thank you, Marietta, so much. I would have been
You're
so
welcome.
upset if we got through all of that and no one could see the slides. Okay.
You're good.
Okay, so where was I? Cardiovascular disease and cancer, and why are we even talking about this? So people, because of early detection and screening for breast cancer, plus drastically improved treatment options, people are living a lot longer after their cancer diagnosis. People are getting cured from their cancer and living years and years after being diagnosed with breast cancer, as well as other types of cancer too. And so with that happening, we have found that cardiovascular disease has emerged as the leading cause of non-malignant mortality in cancer survivors. So for those patients who have had cancer, or people who have had cancer who do not die because of a recurrence of their cancer or don't die from their cancer, heart disease is the #1 cause of death. And so because of this, that is kind of why the field of cardio-oncology has emerged to help prevent cardiovascular disease after the diagnosis of cancer. My goal of this presentation is to kind of shine a light on the relationship between cancer and cardiovascular disease, and provide some education and tips on what we can do and what's in our control to decrease our risk of developing heart disease. These are kind of the slides that I was going to breeze through, but the average woman in the United States has a 1 in 8 chance of developing breast cancer in her lifetime, and this number is increasing. We know that there are more than 4 million breast cancer survivors in the United States. And as I mentioned, people with breast cancer are living longer, which is great. Breast cancer is characterized in a bunch of different ways. There are a bunch of different levels of classification for breast cancer. And like I said, I'm not going to go into detail on all of those, but I just wanted to show how many different ways it's classified. And then based on that classification, the treatment is going to be personalized based on all of the different classifications. Some of these treatments we know are a risk. One of the risk factors is that they can cause cardiotoxicity. And so that's one of the things that we are looking at very closely with some of these treatments. I do want to talk about risk factors for breast cancer though. And I'm going to talk a lot about risk factors. I like to, whenever I talk about risk factors for anything, I always break them up into modifiable and non-modifiable risk factors. So non-modifiable risk factors are things that we cannot control. We have no control over it. So we can't control our age. We can't control our genetics. We can't control our family history of breast cancer or personal history, or our race or ethnicity. And so those things, you know, if they put us at risk for developing cancer or for developing heart disease, there's nothing we can really do about it. But that being said, there are modifiable risk factors, which are things that maybe they're behaviors that we do, or things that we have control over in our life. And so I'm going to focus a lot on modifiable risk factors. And so I'm always going to kind of break it up between those two things. So cardiovascular disease, also called heart disease, it's any group of conditions. It's a group of conditions that affects your heart and your blood vessels. So you can imagine this is a very broad, it's a very broad group of diseases. Almost 50% of adults in the United States have at least one form of cardiovascular disease, and it is the leading cause of death worldwide and in the United States. So when I say that cardiovascular disease is a group of conditions, this is the very broad group that we're talking about. So it can be anything from an arrhythmia, which is a problem with the electrical conduction of the heart. It can be valve disease. It can be heart failure. It can be peripheral vascular disease. So those would be the blood vessels like in your arms or your legs, or that bring blood to the abdominal organs. And so it's very, very broad. And so as we're talking about this, we're talking about this huge group of diseases. Wanted to specifically talk about heart disease in women, because that is the group that we're talking to today. So women are developing heart disease at younger ages than they previously have. We know that when women have a heart attack, compared to men, they are more likely to die within that first year of having a heart attack. And then we also know that hormonal changes can affect a woman's cardiovascular risk. So, and this especially means, this includes, I guess, a decrease in estrogen during menopause will increase the woman's cardiovascular risk. So we know that estrogen is cardioprotective, which could explain why women tend to develop heart disease later than men do, because as that estrogen is still kind of circulating in their system pre-menopause, they're protected. And then as that estrogen kind of goes away, they become at higher risk of developing heart disease. So as women age, we see an increase in LDL cholesterol, which is the bad cholesterol. We see weight gain. We see an increase in blood pressure and an increase in insulin resistance. And then we know that women who experience early menopause are at higher risk of cardiovascular events. Here are, again, modifiable and non-modifiable risk factors for heart disease. Again, we can't control our age. We can't control our genetics. If we have diabetes, then we have diabetes. We can't control that. But I would like you to kind of take a snapshot of this image and kind of think back to the risk factors for breast cancer. There are a lot of risk factors that are overlapping. And so as we go forward, we'll talk a lot about those overlapping risk factors and how if we can address those risk factors, we can kind of multitask as far as decreasing risk for both heart disease and cancer. And then here are some of the overlapping risk factors. So these are the factors that increase both your risk of developing cancer and heart disease. And as you can see, the only one that I have listed here that is not modifiable or that we have no control over is age. So if we focus on making incremental improvements to the rest, we can improve both cancer outcomes and reduce the risk of developing heart disease. I'm going to talk quite a bit about the relationship between cancer and heart disease. We know that adult survivors of cancer have a 42% greater risk of cardiovascular disease or developing cardiovascular disease than people without cancer. This incidence is higher in patients with breast cancer, lung cancer, and blood cancer. And 42% is it's a huge number. I think there are multiple reasons for this. Correlation is definitely a factor, I'm sure. If we share a lot of risk factors, then if you are at risk for heart disease and those are also risk factors for breast cancer, then you're obviously going to be more likely to develop both of those diseases. But then we also have the issue where some cancer treatments have an effect on the heart. And so we know that kind of pathway exists, that just having had cancer and having had cardiotoxic treatments for your cancer puts you at higher risk of developing heart disease. And then there's a lot of new research kind of coming out looking at the other direction too, and kind of suggesting that, we know that patients with cancer are known to experience higher rates of heart disease. But then looking at the other direction, there have been some studies that have come out that have talked about having a cardiovascular diagnosis like heart failure or having had a heart attack, people are actually more likely to develop cancer after having that. And again, a lot of this I'm sure is because of the shared risk factors. But then so what they're looking at right now is whether or not there are some common pathways to these diseases, like having heart failure or having had a heart attack makes puts your body under chronic stress. It suppresses your immune system. It can cause chronic inflammation. And so are those things also kind of contributing to your risk for developing cancer later in life? This is an image that was put out by the American College of Cardiology in their journal. And I think it just kind of summarizes some studies that highlight the relationship between heart disease and cancer. Just to point out a couple of them that relate specifically to breast cancer, they found that 87% of women with breast cancer have one or more risk factor for cardiovascular disease. 62% had two or more risk factors, and a third had three or more risk factors. And we know that having more risk factors is associated with a higher risk of having a cardiac event. Up at the top there's a study that was done that showed that 4.7% of participants with cancer had a heart attack or stroke within 6 months of a cancer diagnosis. So 4.7%. That was compared to the participants who did not have cancer, who had a 2.2% chance, likelihood of having a heart attack or stroke. So much higher chance in the group that had cancer. And then down at the bottom here, that little swimmer there. This is kind of one of my favorite ones. So showing that for women with breast cancer, those who spent 5 hours a week performing moderate exercises before their breast cancer diagnosis had a 40% lower chance of a cardiovascular event and a 60% lower chance of dying from coronary artery disease. So this is their physical activity before their cancer diagnosis. So this will kind of lead very nicely into the second half of my talk, where I focus on prevention and things that we can do to prevent heart disease. And then finally, this is just kind of a neat example. Just again, that relates the two diseases together and just shows how closely they're related. But the ACC, the American College of Cardiology, developed this tool that is used to calculate a person's risk of having a heart attack or a stroke in the next 10 years. So it's called the ASCVD score. It's calculated based on a whole bunch of different cardiac risk factors. So age, race, cholesterol, whether or not you're being treated for cholesterol, your blood pressure, whether or not you're being treated for blood pressure, your history of diabetes, whether you're a smoker. So all of these things are kind of plugged into this tool, and it tells you the likelihood of your patient. For me, if I'm using it for a patient, tells you the likelihood that this person is going to have a heart attack or a stroke in the next 10 years. And so they kind of took this score that's based entirely on cardiovascular risk factors, and looked at that same person's likelihood that they would develop cancer. And they found that having a high ASCVD score can predict risk for developing cancer later in life. So this is just an example of how these diseases are very closely related. Ooh. Sorry about that. Okay. I also do want to talk about cardiotoxicity because it's so much of the work that I do is dealing with cardiotoxicity. And so what we call cardiotoxicity is basically any heart damage or any injury to the heart that is arising from cancer treatment. We know that cardiotoxicity is more common with certain cancer treatments. There are some cancer treatments that have absolutely no known cardiac side effects. We know that it can be reversible, or it can be long-term. And I think most importantly, from my perspective, we know that it is more common in patients who also have risk factors for cardiovascular disease. So managing those risk factors for cardiovascular disease will decrease your risk of cardiotoxicity. Cardiotoxicity presents in many different forms. It doesn't all look the same, and it depends entirely on the cancer therapy that you're receiving, and what the specific pathway is and kind of what the specific toxicity is to the heart. So it can present as cardiomyopathy, which is damage to the heart muscle, coronary artery disease, which is blockages of the arteries that supply blood to the heart. It can present as heart failure. It can present as valve disease, so issues with the one-way valves in the heart not working properly or breaking down. We see arrhythmias, which is again a problem with the electrical system of the heart, and when that happens, it leads to an arrhythmia, an abnormal heart rate or heart rhythm. And so all of those things, when they present themselves, we manage them. So kind of in summary, for that section, we know that people with cancer are at higher risk of developing heart disease. We know that some cancer treatments can cause toxicity to the heart. And we know that having more risk factors for cardiovascular disease increases the overall risk of developing cardiovascular disease. We also know that many of the risk factors for both cancer and cardiovascular disease are modifiable, which means that we can do something about them. So how do we lower risk? What do we do about this? We now kind of know the background about why it's important to focus on heart health. And I have to say, I am an optimist when it comes to preventing cardiovascular disease, because there are so many different approaches that we can take to improving our cardiac health. I'm going to go through a bunch of different things that we can do, or that people can do in general to improve cardiovascular health. I do want to stress kind of what I say to all of my patients, which is that I'm going to talk about diet and exercise and getting better sleep and doing all that stuff. But the thing that I want to stress is that I don't expect anyone to go out tomorrow and totally change their lifestyle and have it be something that is sustainable or brings them joy in life. I think that small changes make a difference. And if we can just take if you can take a couple of things from this presentation that you can incorporate realistically into your life, then any change towards cardiovascular health is making a difference. And so, so I don't expect anyone to suddenly totally upend their life to eliminate every single cardiovascular risk factor. I also like to tell people that given what we know about both cancer and heart disease, and the risk factors for both, then addressing the cardiovascular risk factors can not only improve outcomes for your cardiac health, but it will also include cancer outcomes too. And so it allows us to kind of, as we're kind of addressing risk factors, know that we are multitasking, and there are, we're improving multiple things with these hopefully small changes that we make. So first of all, prior to starting cancer treatment, your oncologist is kind of the person who is helping guide decisions and make decisions about your healthcare and about your treatment going forward. Part of that discussion and part of that assessment is kind of taking into account your baseline cardiovascular risk, to help guide decisions for cancer treatment. That could mean addressing modifiable risk factors at that point, and just determining your overall cardiac health and cardiac risk. They may order some pre-treatment testing of your heart, like echocardiograms or EKGs, depending on the cancer therapy. And that's directed by the cancer therapy that they choose, or that is most appropriate for your cancer. The screening EKGs and echoes are sometimes done periodically throughout treatment as well to help detect early cardiotoxicity, because we know with cardiotoxicity, early intervention is important. And improves outcomes and allows patients to stay on cancer therapy, which is what we want. It's all of our goals. So for high-risk patients, those patients may be referred to cardiology to manage risk factors prior to starting cancer therapy. So now I'm going to pivot to kind of what we as individuals have control over and have power to do. The American Heart Association has put together this Life's Essential 8, which is just 8 key measures that they have kind of spelled out to help improve and maintain cardiovascular health. They break it up into health behaviors versus health factors. So the health behaviors are like the decisions that we make on a daily basis, versus health factors, which are things like blood pressure, cholesterol, weight, like things that we don't necessarily make decisions about on a daily basis, but are still things that we can control. We just may need to work with a doctor to help manage those things. There are 8 topics that they go over. You'll notice that there are 10 bullet points there. I did add the last 2, which they don't include, but I did, one of the risk factors for developing heart disease is having poor dental health. And so maintaining good dental health will improve your risk for developing heart disease. And then minimizing alcohol intake, which they kind of group under diet, which is like totally fine. But I did want to specifically point out that we know that alcohol is known to be a carcinogen, first of all, and then it's known to increase your risk factor for developing heart disease. And that's not something that the AHA talks too much about, so I definitely just wanted to mention that. So let's talk about some things that we can do. We have heard, I think, probably ad nauseum about eating a heart healthy diet. But just in case people don't know what that means, a heart healthy diet is really just focused on eating a variety of fruits and vegetables, eating whole grains, getting your protein from lean sources like beans, nuts, fish, low fat dairy, and then focusing on unprocessed meat or lean meat and poultry. Getting your oils, trying to kind of eliminate oils that or fats that come from animals. So like butter, those kind of things, and focus more on using oils that are liquid at room temperature. So like olive oil, corn oil, sunflower oil, a lot, the cooking oils that come from plants. And then overall, just minimizing processed foods as much as possible, minimizing processed meats, minimizing red meat, and limiting the amount of sugar that you add to food, salt, and limiting alcohol. Physical activity, again, this is kind of one of my big talking points, because we know that physical activity will improve cancer outcomes and will improve cardiovascular outcomes. The recommendation is that you get 2.5 hours of moderate intensity aerobic exercise throughout the week. So that's like 30 minutes, 5 days a week is the recommendation. If you're doing more vigorous aerobic exercises, you can cut that time down a little bit. But I think that, just getting up and taking a walk for 30 minutes, 5 days a week is a great thing that you can do to just kind of get out of the house and clear your head and improve your overall health. They also recommend adding in muscle strengthening and weightlifting if that is possible for you, to kind of increase muscle mass as well. But I think overall, like this is the goal. Overall, just move more. Spend less time sitting. Even light activity is better than staying seated and being sedentary. Sedentary is just kind of spending more time sitting than being up and moving around or sitting for long periods of the day. For me, I have a sedentary job. I spend a lot of time sitting in front of a computer. And so it is important for me personally to find 30 minutes a day to get up and move around, or just take frequent breaks, just get up and walk around, and spend as little time as possible sitting. Sleep is also really important. And I know that sleep is easier said than done. But we know that the benefits of sleep include better brain function, improved mood, a stronger immune system, and better healing, which is important both for heart health, but obviously if you're going through cancer treatment, having the strongest possible immune system and putting your body in the best possible place to heal is really important. And so just kind of some tips for success are one of the, I think, strongest recommendations for sleep hygiene is to go to bed and wake up at the same time every day, because you can kind of train your body that when you reach a certain time during the day, it's time to go to sleep. I know, so a lot of people recommend establishing a nighttime routine. Again, kind of for the same reason, where, you know, when you start doing this routine, you know, it is almost time to go to sleep. And your body just kind of starts to wind down. Dim the lights in the evening. If it's possible for you, put your phone on do not disturb so you're not interrupted throughout the night by notifications that interrupt your sleep. One thing that isn't here and I didn't put on here is to try to avoid screens before bed. And the reason for that is just the blue light that we get from screens, from our phones or from the TV or computer. That blue light really like tells your body it's time to be up and time to be alert. And so it's really hard for your body to kind of relax and go into that sleep mode when you have screens going. Again, that's easier said than done, and not something that I am great at either. But it is something that if you feel like that would work or fit into your life, then it is definitely something that can help with getting to sleep faster. And so those are kind of some of the health behaviors that we do day to day. Moving kind of more into the health factors. So health factors are modifiable, but they might require you to work with a doctor to do so. That being said, there are definitely lifestyle changes that can affect all of these things. And so I'm going to go through some of the lifestyle changes that we can do, you know, with diet and exercise. That we can try before moving on to medications. So blood pressure is an important one. It is called the silent killer for a reason. And that's really, you know, most people don't know when their blood pressure is high, but a high blood pressure over a long period of time can be really damaging to your body. High blood pressure increases the risk of heart attack, stroke, dementia, but also heart failure and kidney disease and having an aneurysm and losing your vision. And so there are a lot of things that are affected by blood pressure. Our goal for patients is to have their blood pressure be at least under 130/80. Any higher than that, and then we have to start talking about either lifestyle modifications or medication, kind of whatever is most appropriate for our patient. Ways that you can lower blood pressure without taking medication are, again, to go back to that healthy diet, minimize sodium. Sodium causes your body to retain a lot of water, which will increase your blood pressure. And so minimizing the amount of sodium you take in is one of the first things that you can do to decrease your blood pressure. Again, increasing activity, sleeping well, managing your weight, and then if you use any nicotine products, cutting out nicotine. Cholesterol. It's another thing that people don't know that their cholesterol is high unless they get tested for it. So, but what is cholesterol? Cholesterol is this fat-like substance that kind of circulates in the blood. Your body needs it. It is something that your body needs to build cell walls and to, you know, it's a precursor for some hormones. And so it's something that your body uses. And so it's made in the liver. But it can also be consumed in our diet and some of the foods that we eat too. So although we need it, when our blood cholesterol is too high, it can stick to the walls of our arteries, kind of causing plaque buildup. And as this plaque gets thicker and thicker, it can cause an obstruction. And so blood can't get to where it needs to go. If that obstruction happens in one of the arteries that supplies the heart muscle with blood, that is what a heart attack is. It causes a heart attack. And then we know that high cholesterol can also lead to some types of dementia as well. The only way to know what your cholesterol is by getting a blood test. So that is something that you should work with your doctor on. When you get a blood test, they'll do a lipid panel, and that lipid panel will show all different types of fats that are floating around in your blood. But the one that we're most focused on is the LDL cholesterol, which is also the bad cholesterol. Specific goals for this kind of vary based on the person, but we generally want the LDL to be under 100 as a starting point. A lot of times we will set that goal to be under 70, which is a bit more aggressive, but I think the table is moving a little bit, or the metric is moving a little bit to say that maybe 100 isn't quite aggressive enough. And so a lot of times our goal is 70. But again, that is a kind of a discussion that you will have with your doctor about whether, like, what other risk factors do you have? Do you need to get it under 70, or are you okay at 100 for right now? Managing cholesterol without medications. I have a lot of patients who are really hesitant to go on medication for cholesterol, which is totally fine. And they want to try diet and exercise first. And I think that's great. I think try diet and exercise. If you're able to do that, then we'll recheck your cholesterol in a few months and see if you've made any progress. And if not, then we'll talk about medication. But cholesterol, so diet is really important when trying to manage cholesterol. We know that cholesterol is found in animal products. So like red meat, processed meat, high fat dairy products, so cream or whole milk or cheese, those are all dietary sources of cholesterol. And so if you're trying to lower your cholesterol with diet, you want to minimize those foods as much as possible. Again, I think moderation is key, and I also want everyone to make choices that improve your health, but also allow you to enjoy life too. And so, you know, if you eat steak 5 days a week, maybe you could eat steak 1 day a week and replace your protein on other days with chicken or with fish, or beans, or some other source of protein that doesn't have as much dietary cholesterol in it. You want to eat meals with lots of fruits and veggies and whole grains. This is where your dietary fiber is really important, or really helpful for removing some of that extra cholesterol from your bloodstream. You want to limit, again, saturated fats like butter and replace them with the healthy fats that we already talked about. Again, move as much as you can, much as you possibly can. Get out and walk around, and then eliminate any nicotine products you'd be using. Blood sugar. So controlling your blood sugar is also going to be really important to preventing heart disease. Glucose, or blood sugar, is needed by all of our cells. Just like cholesterol, we need blood sugar. We need sugar to provide energy to our cells. And so in a healthy person, insulin is made by the body and used to kind of pull those glucose, those blood sugar particles into our cells so our cells can use them. Diabetes is a condition where the body either loses its ability to produce insulin, or the body develops insulin resistance where it can't effectively use the insulin that it is producing. And so the result is high blood sugar, and the sugar is just floating around in your bloodstream and can't get into the cells to be used for energy. Having high blood sugar long-term has effects that include heart disease and damage to your nerves, kidney damage, stroke, vision and hearing loss, and having wounds that won't heal. So it's very important to control blood sugar. A healthy person without diabetes can manage blood sugar by, again, eating healthy, staying active, so your cells are using up all that sugar that is floating around in your bloodstream, managing your stress, getting good sleep, And if you have diabetes, then it's really important to work with your doctor to keep your blood sugar in good control. And that may require medications. There are a lot of different medications to control diabetes. And then finally, managing your body weight. So BMI, or body mass index, is I think this still the common standard for how we measure a healthy body weight. It is a calculation that is based on your weight and your height, and it provides a number, and you can supposedly determine your health based on this number. I do want to talk about the limitations of BMI, because it only takes into account height and weight. It doesn't differentiate between fat or muscle or bone, which all weigh different. They're all different weights. It was developed based on the bodies of non-Hispanic white men. So translating this to people who fall in other categories of sex, ethnicity, or race, we just don't know the accuracy of it. So I think it's really important to note that BMI is it's a good tool to use to measure or to kind of assess body weight and kind of where you are. But I don't think it should be the only one. I just think it's the easiest one, and it's the one that has been used for a long time. So I think it's important to know that, like I said, it can help gauge a healthy weight, but we have to take it into consideration with all of the other factors that I've already talked about. Like if everything else is perfect and maybe you're overweight on the BMI scale, maybe we don't need to worry so much about that. That might be my personal opinion, but it's to be used in conjunction with all of these other tools. So. And then kind of some tips for managing your body weight. Overall, be as active as you possibly can. Take in the same number of calories that you're using on a daily basis. And then, you can, if you increase the amount of fiber that you eat, drink a lot of water, and add protein to your meals. Those are all ways that can help you feel fuller longer, and hopefully not feel hungry all the time. So moving on to kind of who your resources are and who your healthcare team is. When you are going through cancer treatment, your oncologist is probably going to be your point person and your number one person. They are going to be monitoring for cardiotoxicities while you're going through cancer treatment. If you have underlying heart disease or do develop cardiotoxicities, they may refer you to cardiology to help manage that. Also, your oncology nurse or oncology nurse navigator is going to be working closely with you and your oncologist to help monitor and identify early signs of heart disease. So as you're going through cancer treatment, those are going to be kind of your top people to report concerns to. Once you are done with cancer treatment, your care is going to primarily transition back to your PCP or your primary care provider, who's going to take over management of health issues when you're done with cancer treatment. They are going to be the one who's managing your cardiac risk factors. So they should be checking your cholesterol and talking to you about blood pressure and checking your A1C for potential early diabetes. And so, as you kind of progress through your cancer treatment and you're no longer seeing your oncologist every couple weeks, it's going to be important to report these issues to your primary care provider. A cardiologist generally is only involved if there's new heart disease or cardiotoxicity, or if your primary care provider is having a hard time managing your cardiac risk factors. You could get a referral to a cardiologist. Speaking of reporting concerns to your healthcare team, here are some of the things that you would want to report right away to your healthcare team. So obviously, if you're having any chest pain, chest tightness, discomfort, pain that in the neck or jaw or upper back or abdomen that kind of radiates. If you are feeling dizzy or fainting, or if you're short of breath, those are all emergency situations. So that would be a reason to go, those would be a reason to go to the emergency room. Not every cardiac symptom is a reason to go to the emergency room though, but they are things that you should report to your care team. So if you notice any fluttering in the chest, or that you suddenly have a racing heart rate or a really slow heart rate, if you're having heartburn or unexplained fatigue, also, if you have new swelling in your lower extremities, so in your feet or your ankles, that, believe it or not, is a potential sign of heart disease. So that would be a reason to or a thing to report to your doctor right away. And then kind of back to the shortness of breath. I know we did talk about that kind of in an emergency setting, but shortness of breath, like if you notice that you are kind of not at your baseline, or you're getting short of breath sooner, like if before you could walk up a flight of stairs or 2 flights of stairs without getting short of breath, and now you're having to stop halfway up, that would be something definitely to report to your care team right away, because that is a change that we definitely need to work on. Screening for heart disease, again, depends on the symptoms that you're reporting. So blood work, including a cholesterol panel and testing for diabetes and blood pressure monitoring, those things should all be done kind of as part of your primary care. Anything additional to that, so if you're reporting symptoms, they may do an EKG, which is the rhythm strip that's down at the bottom. An echocardiogram is an ultrasound that looks at the structure and function of your heart to see if there are any structural abnormalities. An exercise test or a stress test will look at how your heart is functioning when it's under stress. Cardiac catheterization is more invasive, but would go in and kind of look at the insides of your coronary arteries to assess for any blockages in your coronary arteries. There's imaging like CT or MRI that looks specifically at the heart. And a heart monitor is kind of like a long-term EKG, where you will wear it for 2 to 14 days to assess your heart rhythm over a longer period of time. Treatment depends on the type and severity of the heart disease. So a lot of times we start with diet and exercise, and most heart diseases I feel like are managed with medication. There are some more invasive treatments that are available depending on kind of what the specific heart disease is. I do want to share some resources, because, we talk about all this stuff, and talking for 30 seconds on nutrition or a healthy diet is, it's a lot, a lot of information in a short period of time, and doesn't even scratch the surface. So I did want to provide some resources. One of the, I work for Providence, so I'm familiar with a lot of the Providence resources, and Providence Base Camp offers a lot of different, pretty cool things that are open to the public, and you do not need to be a Providence patient to utilize them. So Providence, Base Camp will offer nutrition classes, and they have recipes on their website. They also have on-demand fitness classes that you can do in the comfort of your own home, just to kind of get moving. I did discover that the YMCA also has some free on-demand fitness classes that you can do, which was very exciting for me to learn that. I might take advantage of that myself too. But they are out there. There are free things that you can kind of utilize to to kind of get moving or get more education on a heart healthy diet. The American Heart Association does also have a lot of recipes and new resources on understanding heart healthy nutrition more. If you are using tobacco products or nicotine products, Providence also offers a nicotine cessation course. I think that this is new. I just learned about it recently, but it is, again, free and open to the public. And it's a virtual online 8-week course where it's a group where you go in and actually set individual goals and you meet for 8 weeks. And so as you're trying to stop using nicotine, you have kind of that weekly check-in. I have recommended it to patients. I have not had any patients complete the course. So I'm looking for feedback on that. If anyone does it, I want feedback on it. And then I also wanted to include, I'm a member of ICOS, which is the International Cardio-Oncology Society. If you or anyone you know is looking for a cardio-oncologist, they have a directory on their website that you can go to and search for someone local. So if you're looking for a cardiologist who specializes in treating patients with cancer, that's a good resource for you too. And then just briefly, we do have a couple of research projects going on right now. I am not involved directly in either of these, and so I'm not going to talk about these in detail, especially since we're right at time. But cardio-oncology is a new field and it is rapidly developing and growing, and we need a lot more research. There are a lot of research opportunities for specifically this issue, the relationship between your heart and cancer. And so research is underway and ongoing. And here are my references. And that's it.
All right. Thank you so much, Kate. That was incredibly informative and just, yeah, I learned a lot myself. So that's great. I'm going to go ahead and turn off our recording.